Hey, I'm Chelsi. Today I'm in Gainesville, Florida, and I want to talk about HIV and AIDS. People have a lot of different ideas about what's going on with treatments, prevention, and testing. So today I'm going to talk to some folks and set the record straight. Hey, can I talk to you for a second?
Sure.
Did you know Florida has the third highest rate of HIV infection in the United States?
Seriously? I thought AIDS was a problem back in the 90s.
Yeah, well, that's what a lot of people think. The thing is, people have started to get a little lax about using protection when they're hooking up, and the virus is on the rise again.
I've got nothing to worry about. I've been dating the same girl for like a year and a half, and she goes to the doctor all the time to see him about girl stuff. I mean, if she doesn't have any news, I'm in the clear, right? If she ain't positive, I got nothing to worry about.
Dude, seriously? Do you guys use protection?
Not anymore. We did for the first couple of months when we first started dating, but then we felt like we knew each other well enough to not use condoms. Felt right, you know?
Dude, no way. If neither of you knew your status going into the relationship, then you're both at risk. Look, there are a lot of people wandering around Florida who don't even know they're infected. At first, HIV symptoms can look and feel like the flu, but severe symptoms may not appear for up to 10 years. That means someone may appear healthy and still have the disease. So it's important you get tested, and test regularly. The thing is, the number one way to get HIV is still through unprotected sex with someone who is infected. Period. HealthStreet is located on 2401 Southwest Archer Road, and they offer free HIV and AIDS testing. It's easy, painless, and it doesn't take long to get your results. And your results are kept confidential. If you can't make it into HealthStreet, find the mobile clinic or the Alachua County Health Department. They'll take care of you there. At the end of the day, it's easier just to go and get the test than hold in all that anxiety about not knowing. Because if you know your status, you can make better decisions that keep you healthy and your sexual partners healthy. There's a lot to talk about when it comes to treatments that are now available for HIV. Things have come a long way since the 90s, folks. And I'm not saying you should go out and get infected because it's totally treatable and it's not a death sentence anymore. But what I am saying is knowing is better than not knowing. Because nowadays, you can live a healthy life with HIV.
But you still have to take a whole bunch of pills and they make you really sick, right?
Not anymore. It's possible to get HIV treatment in the form of 1 pill a day, and side effects have lessened with the newer drugs. Health providers call this treatment ART, antiretroviral therapy. Basically, ART lowers the amount of HIV in the body, so you could still be positive and test negative.
But you can still get HIV from someone on ART.
It's still possible, but the risk is low and can be even lower depending on the kind of sex you're having.
What do you mean? I thought it was risky with any kind of sex.
Actually, that's not true. The most risky is through anal sex, followed by vaginal sex. The lowest risk is with oral sex, and if you're using condoms properly, the risk is even lower.
I thought that if you got HIV, the chances of a sex life were pretty much over. Actually,
that's not the case anymore. There are couples where one partner is HIV positive and the other negative. If the HIV positive partner is on ART and taking it properly, and the HIV negative partner is on PrEP and they are using condoms properly, they can have a great sex life. They just have to be smart about it.
PrEP. That's the thing where I take a pill and then I can sleep with someone who has HIV and I won't get infected.
Okay, look. PrEP stands for pre-exposure prophylaxis. It's a 1 pill a day regimen that people who engage in risky behavior take to protect themselves from getting infected.
Okay, so if I'm on PrEP, I can hook up with someone who has HIV or share an infected needle and I'll be fine?
It's no guarantee. If you're out hooking up and not using condoms, it's still possible to get infected while on PrEP.
So if I'm exposed to HIV and I'm not on PrEP, it's game over, right?
Not anymore. There's a treatment called PEP. PEP means post-exposure prophylaxis. If something happened, like a condom broke, or you shared a needle with someone you don't know, or some other reason that makes you think you've been exposed, head to a doctor right away. If you start PEP within 72 hours, your chances of not getting infected are actually very good.
Seriously? But where can I find out more?
You can go down to the Alachua County Health Department or talk to someone here at the mobile clinic. Check out their website for schedules and locations. Everything is confidential, and they'll tell you if you qualify for assistance. Hey, we have to take our health into our own hands and take responsibility for ourselves. HIV is still out there, and it's not going anywhere. Information is power. Know your status. Get tested. Use protection. Be smart. Check out these other resources for more information.